many doctors feel they're in a position where they have to, to make the patient feel a little bit better for a few minutes, will give them a prescription. But they know perfectly well that is completely useless, because the health of that person lies in their own hands. If they don't do something about their lifestyle, they're not going to get any better. We also know that 50% of patients don't take their medication. They're non-compliant. So there's a 30% waste in modern, at least North American medicine. 30% waste. What industry would tolerate 30% waste? If your water industry in Singapore was leaking 30%, you'd be very nervous about it. So there are really serious questions in the medical profession about the meaning of health and the practice of medicine. In terms of these two conditions that you mentioned, the ADD, for example, there's an article in the New York Times, I think it was from last October, around the doctor who was the discoverer, I suppose, or the man who first diagnosed attention deficit disorder. And he was speaking out very strongly against the way his work had been hijacked and distorted and exploited by the pharmaceutical companies. 15% of American children are now diagnosed with attention deficit disorder. So, you know, I mean, so a child that is a little hyperactive, or a child that's, you know, finds it difficult to concentrate on algebra, you know, and often the reason for diagnosis and the reason for medication, and even the reason that the child himself or herself feels that they should take this medicine, is because they'll get better grades in school. That's it. That's the way it's marketed. And now, the same drug companies, using the ADD diagnosis, which the inventor of it has completely disowned, says the new marketing is to young couples, you know, where they're having problems in their marriage. And one of the posters is one of the couple will have their face blanked out, and it says, you know, this person can't pay attention to their partner. So, if you want this relationship to survive, you better take Ritalin or whatever the drug is. So, I think we have to realize we do live in an age of over-medicalized health. It's not working, it's counterproductive, it produces more problems than it solves. There are up to 400,000 deaths by medical error in the US every year. Pretty high number. Created by inattention. These are medical errors, giving the wrong medicine or taking out the wrong organ or whatever they're doing. So the lack of attentiveness, awareness, and I spoke to a doctor who's the guru of safety in medicine, who is head of the world's safest hospital in Cincinnati, and this is what she said. It boils down to the medical practitioner, the doctor or the nurse, being present, being aware of what they're doing. We have all this technology, this incredible, miraculous technology, but if you're not present when you're using it, you'll foul up. So for all of these different reasons, I think we could say meditation has a very important contribution to make to the development of a new understanding, a new paradigm of medicine. And that's why at the Royal College of Physicians in Ireland, they aim to set up a faculty of contemplative medicine, in which meditation will be a major element, a major discipline. And now that doesn't mean to say that they're going to stop doing heart transplants, or that they're not going to take blood pressure, or use all the technology that is there. But they're confident that they'll be able to use this technology much more usefully and economically as well.